The topic right after lunch then today is on dementia care, Alzheimer's disease, and I wanted to put a little twist on it just as far as the prevention as well as the treatment. And so I think that it's very important for us to as clearly as we can understand a little bit about what may be causing dementia and how we might be able to either for ourselves or for those you love and those you care for be able to help either prevent progression of or improve outcomes with. So I wanted to spend a little time talking about that. It's a topic that's near and dear to my heart for this reason. So Mother's Day tribute, this is my mom, Sarah, and my dad, Ken. Neither one are living anymore, but my mom died with Alzheimer's disease, and it's been a few years ago now. And as a dietitian working in healthcare, I had seen thousands of cases of residents with Alzheimer's, but it was never as real as when it was my mom. And so I have always been passionate about working with the elderly and always been passionate about the people who can't necessarily choose for themselves anymore or think for themselves anymore or whatever. But even more so now. So this, I started doing more research with this following my mom's diagnosis in order to try to help other people that I love and myself and the residents in our facilities and the people that are aging. So this is a tribute to my mom, and she really is kind of the inspiration behind, all that I learn and know about Alzheimer's disease. This is the last days of her life. She got to see her first great-grandbaby, which was really awesome. The difference between the first picture that you see here and the last picture was only a matter of 2 months. The last picture, I put the Dorito bag there because that was the last food that she ate. And it was important for me to not be worried about my mom's good nutrition at that point, right? I was worried about what would be something that would make her happy. So sometimes we get ultra restrictive with, we're going to cure you and we're going to fix you and we're going to do this and that. And we just have to understand that each person, when they can make a choice, is making their own choice. If we can help you all and, everyone else we're dealing with make choices in our younger years that are going to help our outcome in the end, that's wonderful. But restricting foods at the end of life is not the right thing to do. So anyway, my mom, that was the last thing she ate was Doritos, and about a week after not eating or drinking anything, she passed away. And it was beautiful and peaceful, and she wasn't the mom that I knew. Lots of funny things about my mom that, in her dementia years. But anyway, enough about my mom. But it is Mother's Day, right? So just wanted to show you causes of death in the U.S., and these were 2016 statistics. I think I've seen the 2017. They're always late coming out. Hasn't changed. Heart disease leads the way. Cancer, chronic lower respiratory diseases, accidents, stroke. Alzheimer's disease has now crept up into this over the last 10 years, specifically since 2011. I think the numbers have been moving up here. In the elderly, it's actually the 5th leading cause of death. And so there's a lot of focus right now about, Alzheimer's and dementia and what can we do through the diet to help prevent this. And if any of you have worked with Alzheimer's patients, I'm sure you all have, you don't want to be there yourself, right? So anything that we can do, is good. So there's a gentleman that I hold in very, very high regard out of Harvard Public Health, and he also, he's just kind of a big wig in research with this. And this was a quote that he said, "Never has diet been so important for brain health and reducing risk for Alzheimer's disease." And this was a book that I got to work with with a partner on writing. So I'll talk a little bit about that, not a lot. But in that, it helps us kind of look at the foods that can be helpful. So here's some of the statistics. There's 5.4 million people living right now in the U.S. with Alzheimer's disease. 1 in 3 seniors die with it. It's the 6th leading cause of death, 5th in the elderly. And Alzheimer's deaths have increased by 71% in the last decade. And by 2020, they say that there'll be a person diagnosed with Alzheimer's disease every 33 seconds. Okay, so huge. It's on the rise. I mean, that, kidney disease, there's a few others that are definitely on the rise. Lifestyle medicine is the best defense. The only thing we can come up with at this point, there's been lots of drugs that have been being researched and things without a lot of good results. But what they're really identifying is a healthy heart is a healthy brain. So the same things that we do to make our heart healthy, exercise every day, eat a diet that's loaded with color and more plants and less meat and, more fiber-filled foods and less sugar. So there's things that we can do to make our cardiovascular system healthy, which also makes our brain healthy. So food is medicine. I think it's never been more true than that now. And, it's fun for all of you to get to play a role in the health of others. So there's lots of modifiable risk factors. That's the things that we can change, right, that can help to reduce your risk of dementia. Those include exercise and active social life, which I have. I'm going to have an active social life tonight. It's Friday, right? We should have some fun. Quality sleep. So getting 7 to 8 hours of sleep a day, stress management, mental stimulation, so always keeping our mind active, and then a healthy diet, which we'll talk a little bit more about today. So this is just a picture of a neuron, and so we've got neurons all through our whole body and our brain. But the little brown things around the outside that you see there, and then the little black squiggles inside, those are tangles and plaques. So those are the things they find in the brain of people with Alzheimer's disease that they believe is contributing to all of the loss of cognition and the resulting decline in mental status and abilities. Those, I think if they were to do an autopsy on me right now, I might have some of that. The idea is anything that we can do to try to prevent that. The meds they're trying to do are trying to get rid of those things or whatever, and they haven't had a lot of success with that. So for diet in the brain, the things that we know that we need to be doing are trying to avoid the Western diet. When I say the Western diet, it's how we typically eat, right? Lots of pizza, but it was very good. So thank you for that. But if we're eating, pepperoni and cheese and all that on our pizza, and we're eating that all the time, we're having burgers and fries, things that are processed, highly sugared, low fiber, high meat, high saturated fat. That's a Western diet. And that really is what is killing our world, our U.S. at least, our nation, I guess. Maybe not the world, because parts of the world that eat lots of vegetables and fish and stuff aren't having the same problems we are. Inflammation, you think about that like you get you sprain your wrist and it swells, okay? You get a cut and it gets, kind of puffed up and red. That's inflammation. But the same thing's happening in our body from eating, foods that are the kind of our Western diet type of food, not eating a lot of plant-based kinds of things, legumes and, all of that. So the same reaction that happens when you get, pounded on the arm or whatever and you get a swell, those kinds of things are happening internally, in our cardiovascular system and in our brain. They're finding a real relationship with our gut and our brain. So you probably have heard a lot about probiotics and fermented foods and things that can be helpful, for our stomach to make us have a healthy gut. They're also recognizing that those also help us have a healthy brain. So we want to make sure we're trying to include as many healthy plants and fats as we can. And that goes back to our menu that we're serving in our facilities. I think we do our seniors a disservice with the food quality that we serve sometimes. So I don't know whether you are privy to the budget that you have for your meals every day, but I do recognize that it is basically less. We provide less dollar amounts for our residents in some of our skilled nursing and assisted living facility per day than would be the poverty level dollar amount that we would get through food stamps and that kind of thing. So sometimes it's $5 or $6 per day, not per meal, that's allowed for food. And so I'm maybe preaching to the choir here. You all can't necessarily change that, but I think the best we can do with the dollar amount we're given, it's not buying, prefabbed, high salt, high fat kinds of things. If you all can be good at cooking from scratch and trying to use the chicken to make the stock and not use a chicken base and, that's all so salty, those kinds of things, you can actually keep your budget neutral and still have a better outcome and product. Buy, as much as we can, some local, produce when it's in season. I mean, Idaho, where we talked about already, we like to have potatoes on our menu, but potatoes are very healthy food. They've gotten a bad rap, but they're great. It's a vegetable that has fiber and lots of nutrients in it. So anyway, diet in the brain. This is just a complicated slide just about Alzheimer's and all the things that are involved. So I don't want to say we're going to prevent and cure Alzheimer's disease with a diet. I'm not on the record for saying that at all. I'm just saying there's a chance we can do better with this for our overall health for ourselves and our residents. It's just some handouts here that you can have. So a mind-nourishing plate. So if you kind of think about what a plate might look like, that would be the healthiest, best to try to have the nutrients and things that'll enhance the mind. It's half of the plate with leafy greens and other vegetables, okay? A quarter of the plate is going to have your protein sources. It's maybe fish and, I list eggs and nuts and seeds as alternatives to meat sometimes too. Whole grains and legumes on the other. So that's going to be beans and peas and lentils and, all that, as well as whole grains. Adding in fermented foods and fruits, lots of spices and herbs rather than using salt. Let's use, and we're going to Amanda's going to talk about that later, or, herb garden and things that we can do in our facilities to be able to have, some things that are inexpensive and at your fingertips to be able to use. I guess I'm transitioning now at this point from prevention into treatment. So a healthy diet is only as good as the food that is eaten. And so that's a quote. So what we recognize with our residents that we have that have dementia is it can be the most healthy. You could just go back to my healthy plate and you could have a half a thing of arugula salad with, a bulgur pilaf, and you can have, some nice little piece of fish or whatever. It's not going to do anybody any good if they don't eat it or ingest it. And so a lot of times when we get to the point where somebody already has a cognitive deficit, mild cognitive deficit, or beyond that, really, we probably are not going to be able to make a lot of change. I mean, if somebody is 80 years old and they've eaten the same diet their entire life, and that diet has never included a vegetable, I mean, now is not the time for us to start pushing the vegetables. So it's only as good as we can, get the person to eat. There's lots of reasons why someone's appetite can be reduced, and some of those may be related to just the fact that they're not necessarily remembering things. Depression or loneliness is really, really huge in our elderly. So, sometimes 75% or more of our residents that are entering our facilities are depressed. And I think it's had a stigma for so long that we're like, depression, you can't. I know my own dad, he was totally depressed. He had every reason to be. His wife had Alzheimer's and he had end-stage kidney disease and all these things. But to think that he would talk about taking an antidepressant or doing something about that, wasn't going to happen. But so there's a lot of loneliness and depression as a potential reason for poor appetite. Physical discomfort. So we need to be looking at pain and you all, as you're out in the dining room or as you're watching your residents come through to get their plate, however it is that you're, seeing that, you can identify pain, right? So how do you see pain? Okay, sometimes it's a grimace. on a face, when they reach out to get something from you or you shake their hand. Sometimes they can tell you and sometimes they can't. But, it's a moving around in the chair. It's a, kind of, if somebody isn't verbal, it comes out in a swatting, a hitting, there's lots of ways. And so it's not beneath you or above you to help your facility identify pain. And it really is a big deal as far as how people eat. There can be damage to the brain. I mean, sometimes with Alzheimer's disease and dementia, they're finding now that maybe it was when, and I say this, hopefully this will never happen, but my husband, when he was little, he fell off of the couch onto a cement floor and hit his head and, had a concussion. And it's like those things can come back later on as, showing as dementia or Alzheimer's disease. They could possibly have just a lack of exercise and movement, which can make their joints stiff and that kind of thing. But also, you just don't feel like eating if you're not really moving. You get constipated too. People that are sitting around and they're eating that Western diet that we talked about that doesn't have a lot of fiber. And so that, that's one of the other things. But, the lack of exercise, those two things play together. Chewing and swallowing difficulties, those come just by, we lose our dentition, especially if we haven't kept up on it. The swallow we talked a lot about in the last session. GI problems could be constipation, diarrhea, whatever. Any of those things that are causing bloating, causing problems in the stomach can cause somebody to have a lack of appetite. Medications, there's a ton of meds that have side effects of this. So we need to just be aware of all of the things. And I think, again, as a dietitian, you all are my eyes and ears for what's going on with the residents so that I can take that then and hopefully help do something with it. So just, again, realize it's your responsibility as well. Okay, so I'm going to go through really quickly some of the things that can happen in the different stages of dementia and Alzheimer's disease and how those things can affect nutrition. And then we're going to do a little demonstration up here. I have a special demented guest here today with us, and so we're going to be working with her a little bit. In the early stages, so I've divided this into early, middle, and late stages. And, they used to have them defined that way, and now there's different ways to define them. But I'm going to keep it that way just for simplicity's sake. They may forget to eat or drink. Okay, or forget they've already eaten. So how many times they're like, Mrs. Smith, like, can I, is it dinner time? And you're like, well, you're trying to orient and you say, well, you just ate dinner 15 minutes ago. And we know that doesn't do any good, right? We have to say, are you feeling hungry? Can I get you a little snack? Or let's get you a glass of water or, something along those lines. They may decrease their variety of foods eaten. So, I have come across people that have lived on Cheerios and milk for years potentially, so just limiting that because it's outside of their ability to think about menu planning and food prep and all those things. They may be unaware of spoiled foods. They may eat from dirty dishes. They may store food in inappropriate places. And, sometimes that's dementia, sometimes it's other psychological issues, but the whole 2 weeks of milk that was brought back from the dining room and stored behind the shelf, that you find only through smell, is like those kinds of things are real and happening. So we have to be able to provide, adequate supervision and ways to keep their food safe in our facilities too. They may forget that the food is cooking on the stove. That happened with my mom at one of the first signs. She was a great cook. And, she never would have left anything to burn on the stove. So, those are some of the signs at home. May have trouble with meal prep or grocery shopping or simple things like maybe writing a check in a checkbook. Adding my mom, it was her taxes, and she worked as a tax accountant for a while in a county, and so the minute she couldn't, figure out, and she was arguing with me, which never happened either about that. So there's ways in this early stage that a lot of people try to justify that, their family member maybe is just just a little forgetful or whatever. And there are tests that you can do that can be done to determine whether it's just, because sometimes I think I'm in the early stage. Where's my keys and where's my shoes and where's this? But and then they may give an unreliable food history. It's like, Sue, how much do you weigh? Well, I weigh, 102. And it's like, well, Sue, I don't think you do, but no. So what do you, a lot of times we'll get the family that'll say, oh, mom is a strict vegetarian. She never eats meat, right? And then mom's like, where's the bacon? Where's my hot dog? I want this, whatever. So, we really have to meet the people where they're at too. And as long as it's not this, if the person is still able to make those kinds of choices, we need to be making sure that we're honoring them. Maybe she decides she likes bacon. So that's going to be me. I'm going to have a cocktail and bacon. That's what I'm going to have every day. So the middle stages, they may not recognize eating utensils or how to use them. They may experience changes in ability to eat, so chewing, kind of low attention span, so sometimes even just keeping food in their mouth and not really remembering to chew or swallow. They may eat more high-sugared things and things that are salty and may be craving those. And I don't know if you know this, but at the age of 75, you've lost about 75% of your taste buds, okay? So when we're restricting salt because we think it's really good for them, or, we're only serving dessert on a special occasion, we really are kind of messing with the elderly's taste perception because, they're the last things they can taste are salt and sweet, and that's why they seek those out, okay? They may start losing weight. Inevitably, that's what will happen, but in this middle stage, they may start losing weight. They may be unable to communicate hunger or fullness. They may be overwhelmed with food, confused by food, right? They may eat non-food items thought to be food. So I've seen the betta fish on the table as the centerpiece. Glug, glug, glug. I've seen flowers, the artificial poppies, that are on the table. It doesn't mean we shouldn't decorate our tables and shouldn't, because it's important to have things look nice too, but we do have to, be supervising and overseeing that and aware that this is likely going to happen. It really does bother me, though, when I go into a memory care facility or a unit that, they have people that have Alzheimer's and dementia, and there's nothing on the walls and there's nothing anywhere. I mean, it's like, to me, it's so depressing. And, so we can do a good job of livening up our dining room. Maybe it's a mural instead of it being a picture that could be, whatever, taken down or whatever. So, okay, and then the late stage may become dehydrated, okay? Thinking about at this stage, they probably have lost their ability to do a lot for themselves. So the weight loss and the dehydration are real. They may still participate in the feeding process, but they may not. They may need to be fed. They may pocket food, forget to swallow. That's where the risk of the dysphagia and all that is a big deal. A lot of times that's when we end up needing to downgrade, maybe even in the middle stage, the diet. They may refuse to wear their dentures, to eat, to be fed, to be bathed, to take their meds, to, all of those things. So it's a lot of reapproaching, sometimes reapproaching by another person. Sometimes it's bringing in a snack right after instead of the meal that you've provided that they don't want to touch. They may lose weight even with adequate diet. So something happens metabolically. So I've known, a lot of end of life Alzheimer's residents who are consuming 2,500 calories, 3,000 calories a day, still losing weight. So there's something that happens with the metabolic process. And, it makes sense to me. Like, our bodies are pretty smart. It's like, I'm done, and so, sometimes that will happen. A lot of times just flat out with my mom. I mean, here I'm a dietitian, right? I'm supposed to have this healthy, mom in her passing. She would not open her mouth. I mean, she was done. She knew she was done. She wanted to be done. It was the fastest way for her to be done, was to quit eating and drinking. So, that there has to then be discussions about nutrition support. Do we do supplements? Do we do tube feedings? I mean, there's pretty solid research that tube feeding in end-stage dementia does not prolong life. It actually shortens life, because there's all kinds of other physiological things that are happening. So the answer is not, if I loved my mom, but I knew better. I mean, I'm not going to put a tube down her. And if she decided that she had wanted that early on, regardless, then yes, then we have to honor her wishes. But if I'm the decision maker, and I know the research is that, this is not going to prolong life, and it's pretty invasive, right, to do. So. Okay, so with that, I am going to, this is my friend, and he's currently living with dementia, and he's just a super funny guy, but so I put him up here, but I'm going to invite Polly up, and Polly has early to middle stage Alzheimer's disease, and Polly she's super sweet, but she, what I want you to do here with Polly is and I don't know, if you can't see in the back, you're welcome to kind of stand up if you'd like to, but I want you to observe and kind of jot down anything that you can think of that either is going right or wrong with this situation with Polly. And Polly's going to be served a lunch meal here. But first of all, now Polly, you need your sling on. So Polly has a hurt arm, and so I'm going to put her sling on, and it's her right arm that's hurt. So you're very helpful, Polly. And you forgot your glasses.
Oh.
So here.
I always forget those things.
Yeah. Then put your glasses on.
Uh-oh.
And
They're not really helpful.
You need to wear your glasses, Polly.
Oh, okay.
And you're always so messy. I've got to put your bib on here. Put this bib on you. Oh no, this is a bib. Are you hungry, Polly?
Not really.
Well, it's lunchtime. We serve lunch right at 12, and it's lunchtime.
I just ate.
No, you didn't. You didn't. Okay, so we have, I heard, your family said that you like a big spoon to eat with. So here's your spoon, and we're having potatoes and meat, some green beans, and then you can have either of those drinks you want. And for dessert, we're having this little bar here. So, go ahead, honey. Polly?
What's on the plate?
Oh, that's lunch.
Oh, okay.
Yeah. So you need to eat. Your daughter Sally said it's important for you to eat.
Can you tell me what this is?
That's the starch. Not so big a bite. Those are too big. Good job, Polly. If you're thirsty, there's a couple drinks over there for you. Come on, Polly, we only have 15 minutes.
Do I have to eat?
But, so why don't you go ahead and have a drink? And you have a protein shake there that you really need to drink. I hear you're getting dehydrated, so we've got to get you. That's not the protein drink. That's the orange. It's the other one.
Could you? I can't open this. Could you open it for me?
Okay. You know what? This costs a lot, and we're going to save that. Save that for somebody else. All right. Thank you. You did a nice job. So anyway, I think a little bit of audience participation here. For any of you that could see what was going on up here, can you tell me some of the things that you saw that either went right or wrong?
Treat her like a child.
Okay, I treated her like a child. What's that?
You were hovering.
I was, yeah. Back here, right?
Yeah.
Yeah. Mm-hmm.
Yeah.
There
Trying to
wasn't a
rush her.
demonstration.
What's that?
Demonstration.
Oh yeah, I didn't mentor her or show her or help her set her food up, right? So this is all she had because her family said she liked Big Spoon. I'm not sure if I mentioned that. She didn't have anything to cut her meat with, even if she could have cut her meat. Anything like this should be opened, poured into a glass. All this clutter, taken away. So this was her dessert, which she probably never would have been able to get into. Her meds are here too, if you didn't notice. So she, would have had to get into her own Advil if she had any pain. The glasses have seen better days. Mm-hmm. They have goo all over them, so she couldn't see even if she had wanted to. She's right-handed, and her arm was in a sling, her right arm, so she was trying to use an arm that she's not used to eating or whatever with. And although this was a little dramatized, I can't tell you how many times some sorts of this are seen, that maybe we're not really looking at what does she need functionally. In this case, I'd love to have her still be independent, but maybe that would be with a plate guard, something that she could still scoop and, making sure that the food was already at a safe level for her to be able to feed herself. She wasn't straight on to the table. Definitely things weren't set up. So how about any other observations?
She asked what she was eating.
You did tell her.
And you did tell her.
Yeah. Sometimes the aides don't know. I mean, and it's reality. Like if I just showed you my puree plate this morning, would you have known that was green beans versus broccoli? So it's important for you all to have the rest of the staff know what the meal is. Not just the residents, but everybody else needs to know what that is too. And that's the exact reason why.
A lot of times we have two similar items that are almost exactly the same, just like yesterday.
Exactly.
And they're like, which one's the vegetable? So we had to go through, and that's the lasagna, that's the carrots,
Yeah. So sometimes the foods on a plate will look the same. We have a lot of, white and brown foods in our, on our meals, especially if we're serving rice, potatoes, pasta, whatever, and then a lot of the beef and porks and chickens are all going to be the same color. So it's important to distinguish that. The one thing I did do right here is I put it on a colored plate. So there should be, a contrast between that. So a white plate with white food, not good. I didn't make up one more plate. I had to use what was from before. Anything else? What other observations?
You declined to assist with the protein shake.
Yeah, I
and
know.
then you were going to send it back to be reused.
Exactly. Not a good practice.
You told her she wasn't worth it.
Yeah, that was really bad, wasn't it? It is my husband's protein shake. So I thought, if I open it did cost $1.50. But I've definitely like the not helping part of it, and kind of like degrading in a way of. I mean, it's all degrading if you're not helping or if you're talking down to or any of that. So just wanted you to kind of feel that this type of in-service presentation really easy to set up. I would encourage you to maybe think about doing this, in your own facility too. I've been through a few kind of sympathy or empathy trainings like this, and I think they're really useful. So you do have a sheet in front of you that has basically tips to help you, and I just have listed them very quickly here. Reducing noise levels in the dining room is helpful. Minimizing distractions, whatever that distraction could be. Sometimes it's even, the constant wheeling in and out. Sometimes it's loud music. It can be those kinds of things that, we might want a nice soft music, but it needs to be something that isn't going to be disruptive or distracting. Provide simple meal choices. So not a lot of choices, right? I mean, you want to know what they like, and you can keep the choices one of two things. Maybe it's not serving dessert until the end, and at the end you say, would you like ice cream or a cookie? Something that's very, very kind of simple. I think I love the idea of a select choice menu, but in this population, it doesn't always work because it's overwhelming. I mean, my mom going out to a restaurant the last bit couldn't make a decision, I basically had to do that because she couldn't make a decision. Model and demonstrate eating behavior. So you talked, somebody brought that up, that it's really important to be able to show and and help, and even help them put the utensil in their hand sometimes or whatever. A lot of good data about actually having a resident sit with someone else who's like maybe somebody who's having some trouble knowing how to use utensils, to sit with someone who's really good at it, and whether that be another resident that is a good eater or whatever, but making those pairings rather than 3 people sitting together that all are way out of it and don't know how to feed themselves. Small frequent offerings of food is often better than big large meals with lots of choices. Contrast in color and texture to give some variety. Sometimes it is that just 1 or 2 foods are presented at a time. So maybe it's using a smaller plates and just serving one of the items at a time when that's done, because otherwise it's the, mixing the, yesterday in the facility I was in, he was putting ketchup on his sweet potato instead of, what I think it was meatloaf or something they had. And it's like, I probably wouldn't have served ketchup in that scenario because it didn't necessarily make sense and it was just very confusing for them. Making eating easier, just, whether that's through adaptive equipment or through having the right texture for somebody, and then an attractive presentation. So we don't want to forget about that, but that attractive presentation should be edible, okay? So, sometimes I'm seeing, I'm seeing parsley on the plate that it's not, or a big hunk of kale or something like that, that, they're going to put into their mouth that's probably not always the most edible thing. So you want to keep that in mind as well.
I'm just going to add a couple slides to the presentation, a couple points. I did have the opportunity to have mentioned before, my grandfather lived with me. He had some dementia at the end of his stages of life. And what I wanted to add was just a few more additional things that you could do, probably things that you've maybe tried or have heard of, maybe haven't heard of. So I would always have some tasks for him. So as he was starting to decline, it's important that he still wanted to be part of the meal, so be part of the process. It was a big deal to hold on to those traditions. We sat at a table, there was a placemat, and I asked him to set the table, and I could tell as he started to decline that his ability to do these tasks, as we would say correctly, became much more limited. So one day I asked him, okay, Grandpa, we're gonna set the table. I gave him all the tools. He always liked to have a butter spreader for the butter. All these things were very familiar to him. This meal was breakfast because I have some syrup there. And so I said, I'm gonna have you set the table. I'm finishing making whatever it was I was making. And then I went over and looked and I thought, oh dear, here we've gone a little bit off the path. But what I didn't do is say, we didn't hit this on the mark. We didn't get this quite right. I just never corrected him. Just always just let him go through that path, because no one feels good about the mistakes he would make. And I'm sure you've heard that before. But any task that you can have. I worked in a locked unit, and there was a gal who she loved to wipe things down. They gave her a dry cloth, no chemicals, nothing that she could harm herself, and she just liked to wipe things down. And to her, having a job, having a task was important. There might be folks that won't need a task or they're not interested in doing that, but I would never criticize the task that they are doing, and I feel like that's pretty intuitive. But I also want to point out there's never a wrong answer. If someone's continuously calling something that's lasagna, pizza, that's fine. I would just let that go. There's so much of the urge, I see this with family too, is they want to correct, and it becomes so frustrating. Or even with my grandmother on my dad's side, my grandfather would say, she's not getting this right, we're not in this city, we're in this city, or this is not what we're doing, or she didn't understand this. And it was just frustrating to him, it was frustrating to her, and they became frustrated together. And it was it's not the way that, we want to have all of our loved ones remember. The end of the life was this constant correction and battle. Just, let her decide, or let her kind of go down that road. I'd always say, let her just go down the rabbit hole with her. And everything is going to be fine. Just to kind of piggyback onto what Sue said, I think a lot of the things that we're doing is great. The one thing that I would always do is, if someone was at end of life, wanted, ice cream or something like that, I'd always let them feed themselves, even if it got messy. I had a little gal that was in a wheelchair, and she would, push herself with her feet. You probably have a little gal or guy that does that. They're very mobile this way with their feet. And so she would just swing around by my desk. I'd be charting. She'd say she wanted ice cream, and everyone would tell me, oh, she hates ice cream. But she would follow me to the kitchen, and she would want ice cream. And anything she could hold in her hand, this motion becomes very much more familiar. So a lot of the diets I would write for early dementia, still able to go to the dining room, would be I would have all of the foods served in bowls. So that would be appropriate for, before I was talking about all these side dishes, they never got eaten. There would be no plate, and it would be maybe 3 little bowls. So if you can kind of see, I feel like this is a face I saw a lot, was this lady's like, look, I'm bringing you soup. And his reaction is, oh, wow, that's a huge bowl. This becomes a very, very long distance. So I think that becomes probably like an unsurmountable task. There's always the feeling of, I'm going to make a mess. I'm going to let someone down. I can't eat all of that. So if you have a little bowl, a little goal, let's kind of say little bowl, little goal, then at least we're getting something. And you'd be surprised if you put a vegetable in a bowl, they can hold it. This is a much more shorter distance. I just saw so much more success. My other kind of point with memory care is the beverage cart. Beverage cart and I, we have a tough relationship. As a dietitian, it's tricky, and I think probably Sue sees this as well. We want to encourage hydration, we want to have meal satisfaction, and then you find out the person's not eating, yet they're having 4 cups of cocoa before the meal. And this is where the beverage cart is not doing you a service, unless you're to the point where you're just letting the person have whatever you'd like. And so that's where you might need to individualize, what is the most important thing? Are we just, eating? Do we want to have some calories? Do we want to have some other high protein foods? We know that beverages are empty calories, sugar, not a lot of protein. And you'd be surprised how many people would tell me, oh, but the cocoa has a lot of protein, like they're fine, it's balanced, it's really not though. So I actually have, this is one of our Cisco items. Swiss Miss is not, it's one of our items we offer for sale. We have nutrition facts on our website for almost all of our items. So we're looking at 90 calories, 1 gram of protein, and pretty much the stomach is full after that. Your stomach size kind of reduces if you're not eating a lot of foods. And so we've filled up that stomach with 90 calories of just some sugar, a little bit of fat, a little bit of protein, but just lots of volume, right? We've taken that all the way up. And so I would work with your speech language therapist if you're in the skilled setting assisted, maybe come up with some different ways where you could maybe not have so many beverages or not a beverage right before, but that usually is where things can kind of take a turn for me when I start to see some weight loss, or maybe some, I couldn't eat dinner, or I just wasn't hungry. And I'd find out, so we had 3 cups of cocoa before. So just watch your beverages. It's not going to be a good fit for everyone. Also, the cooks would tell me, I don't have time to cut up items. I don't have time on the line, or I'd always have the worry that someone's going to get injured on the line, because we had someone who was always trying to cut something up last minute. So this is a good tip to cut something into bite-sized pieces that's safe. No one's been seriously injured by a pizza cutter that I know of. We want to make sure that we have a way to maybe cut foods down, finger food, and something that is doable for on the line. So I would see a lot of plates go out that are supposed to be maybe a little bit easier to eat, bite-sized. Also, the example with using the large spoon, there was just a lot of pressure in the dining room from too many people to, use your fork, do this, just too many rules. Just say, they want to pick it up, they can pick it up. If they want to eat, if they want ketchup on their, other items, it's not hurting anything, let's not get so worked up about it. I think there was just too much pressure, too much stress, too much dialogue too. I think there was just the constant need to interject, either to be positive or to correct. Just kind of, just let it happen. And like Sue was talking about, the body has a really good way of regulating. Maybe they had a lot of food the day before, and your body will sometimes not want to eat much the next day. People get really worried about if they're not eating. It's something that, especially towards the end, just going to have to let the the cycle naturally work its way.
Okay, so thank you everybody for coming. I know that all of you deal every day with residents in your facilities that have dementia. So, you know, recognize your role in, which is a really, really important role in, you know, preparing and serving the very best food for them. And, you know, Amanda had said, lighten up, recognize that, you know, that these people really just need us to love them and you know, be kind. So,
Great, thank you.
thanks.